So what about over-the-counter sleep or anti-snoring devices that we hear about through ads and things like that? Do they work? Are they effective? And what are your thoughts?
You know, they can work for some patients, but really they carry a much lower success rate than these custom-made devices, and research supports that as well. The main thing I hear from my patients is that the device just doesn't stay in. It often falls out. Because can you imagine you're making one device that's supposed to fit everybody's mouth? It's just not going to happen, right?
Okay.
A matter of fact, I just had a patient who came in yesterday, true story, Larry, by the way, his name was, and he came in bringing a temporary device in that he just couldn't use, and he was asking me, Dr. Shah, can you do anything better for me than this? And I said, absolutely. So we were able to get him into a much more comfortable, custom-made device that hopefully will be a lot more effective for him.
Let me take a look at that little, now this is this is the one you use. And I don't know if they could tell me, but this is very small.
Yeah.
I've had the over-the-counter in my hand.
Yeah.
This is smaller than
Absolutely.
that and much lighter.
Yeah, absolutely.
So
It's because this is custom made to fit your teeth only. It's not going to fit anybody else. So
is it like bleaching trays in a way?
yeah, in a way it is.
Could you put bleach in there?
It's not much thicker than bleaching trays. No, I wouldn't do that.
Okay, all right.
I wouldn't put bleaching trays in it, but it's not much. I wouldn't put bleach in there, but it's not much. It's not much thicker than bleaching trays. Really, that's all it is. Which with a some kind of connector or hinge on the side that allows the jaw to be adjusted to 1/10 of a millimeter, so that we can take them not to the farthest position, but to a comfortable forward position where it's also effective at treating their sleep apnea as well as their snoring.
Okay, now some of these over-the-counter, I've talked to some doctors anticipating this interview, that some of these over-the-counter remedies can move teeth.
Yeah, absolutely.
They can, and so the custom devices.
Yeah, the custom devices can as well.
Okay.
But I think the difference here with the over-the-counter devices is that there's no one managing the patient's care, right? So you're getting a device, you don't know what it's going to do to your teeth, and if it does something, who's going to help you with that, okay? And you don't know how effective it is. So is it really helping you breathe better? Is it really helping your snoring or your sleep apnea? You have no idea.
Now, I'm not trying to side with you, but because I've had somebody on the show where they made one of these devices, they boil it in water, so you only get one position.
Exactly,
And you're
yeah.
saying that the success of your center, and I'm not putting words in your mouth,
Yeah.
but because you do this full time, you're able to, there's a lot of adjustment, or at least 2 or 3 times to adjust this to make it right.
Yeah, absolutely. We want to follow up with our patients at least 2 or 3 times after they get the device, because this isn't a guessing game. We're not just putting the jaw randomly where we want it to be. Okay, it's really finding the optimal position for the patient. I call it a sweet spot, right, where their breathing is better, but yet the device is very comfortable. So it's finding that position takes time, right? We want to get feedback from the patient. How are their symptoms improving? How does it feel comfort-wise? What is their spouse sharing in terms of in their feedback on how the device is working? So we put all this information together, as well as we have in our office, in real time, we can measure the patient's airway using a machine with sound waves. It's kind of like sonar technology. The machine emits a sound frequency that reflects off of the soft tissue, and we can actually measure the size of the patient's airway in real time while they're sitting there in the office with the device in their mouth, and we can compare before and after results of how much this is opening up their airway and allowing them to breathe better.